Our next speaker is Dr. Jessica Finck. She is actually a meat scientist, and she is a graduate of Texas A&M. She got her master's at Texas Tech, and she got her doctorate in meat science from Colorado State University. She has been with Merck, and she started in the kind of the consumer affairs division. And she was very instrumental in developing a cattle mobility scoring system. And now she works basically with the packers and retailers. And I wanted her to come speak to us tonight because I think it's important that we understand what the packer and retailers' perceptions and expectations are for antibiotic use in beef production. I think that's a side that's really important that we don't hear a lot of. So with that, go ahead and start, Dr. Epperson.
Hello, I'm Jessica Finck with Merck Animal Health, and I am on our corporate and diversified accounts team. My job is to primarily work with packers in the areas of food safety, animal welfare, sustainability, and traceability, and then act as a resource for them for helping answer customer questions or in anything related to live animal production. So today I've been asked to visit with you guys about packer and retailer perceptions and expectations on antibiotic use in beef production. So to do that, we'll get started with learning to know more about what our packers' views are. So I went to each of the packers' websites and pulled off snips of what their antibiotic policy is. Most packers deal with multiple species. So this is all-inclusive beef, poultry, pork production, and sometimes turkeys. So with that, Cargill, it will be our first packer. They say, while we support the responsible use of human antibiotics in food production, we are committed not to use antibiotics that are critically important for human medicines as defined by the World Health Organization. And then it goes on to say, Cargill favors a rigorous, globally harmonized antibiotics regulatory system that is science and risk-based, and we support the appropriate use of government-approved antibiotics in farm animals and feed. So then we'll go to Tyson next. Tyson, theirs is listed under their animal welfare. So all three of these are listed under animal welfare. And then Tyson's is specifically on antibiotics, hormones, and steroids. So Tyson at the very top, it says, we're committed to raising the livestock and poultry we depend on responsibly. That means only using antibiotics when needed. And then it goes down under this finding antibiotic alternative section, and it says, we have ongoing efforts with independent farmers and others in our company's cattle, hog, and turkey supply chains to discuss ways to reduce the use of human antibiotics on cattle, hog, and turkey farms. So then we'll get to JBS. JBS's was by far the most detailed on their page. And at the very top, it says, at JBS USA, all antibiotics are used under the supervision of a licensed and accredited doctor of veterinary medicine, and only for the purposes of preventing, controlling, or treating disease, rather than growth, promotion, or feed efficiency. Then on down, it says, JBS USA supports the judicious use of antibiotics under a valid VCPR and in accordance with the Beef Quality Assurance judicious use of antimicrobial guidelines for cattle. And it goes, and you can even scroll down on this page and see everything that it says. But then at the very end over here, it says, the farm and ranch partners who supply cattle and help guarantee compliance to these requirements by completing an affidavit at the point of sale and are randomly third-party audited, ensuring compliance with the BQA system. So since JBS is my major packer, I'm most familiar with their policies towards this. So in April, we had a lunch and learn where they went through and kind of talked about their scorecard and where they ranked at the end of 2019, knowing that a lot of these goals ended in December 31st of 2020. So by the end of 2019, and these are slides taken from Dr. Kim Stackhouse, who was doing the presentation, at the end of 2019, they had 25% of those suppliers third-party verified. So when I said that they had the affidavit, then they were also third-party verified, randomly third-party verified, and they had 25% of those suppliers third-party verified. So what do they do to accomplish these goals? JBS really feels that supply chain collaboration strengthens their relationship with their feed yard partners. They ensure the participation in the BQA or equivalent programs and increase communication sharing, both back and forth with their producer partners. So under their producer engagement plan, the participation in the BQA or equivalent program, it requires JBS set forth the requirement to ensure the cattle affidavit was at 100%. So to be able to ship your cattle to JBS, you have to have that written and signed affidavit ensuring compliance with BQA or equivalent programs. The second part is that 60% of their cattle from feed yards came from those listed in that NCBA feed yard assessment database. And that goal is to be by January 1st of 2021. And then lastly, like I said, at the end of 2019, 25% of their cattle were third-party verified in accordance to the BQA assessment or something equivalent. So this BQA assessment that I keep, feed yard assessment that I keep referring to, is pretty simple. So it requires an on-farm audit at minimum once every 3 years. It also requires all of your employees be trained, BQA trained, whether it's through the online system or through a face-to-face meeting. And then it also requires those feed yards to release their information to the database so that they can be listed and the packers can verify compliance and completion of these requirements. So part of the second part of that producer engagement plan was increasing communication and information sharing, both back and forth amongst their partners. So in 2019, JBS USA beef leadership team went on a roadshow and they went to all of the packing facilities and they met with their major producers or suppliers to those facilities. And what they did, they simply talked to them about market conditions, exports, customer expectations, really meet who you're selling your animals to. And then they were also able to host those BQA or equivalent program trainings to those that were coming up on their expiration date. So that's a little bit about what the packers are saying and specifically as an example, what JBS is doing to ensure compliance with their antibiotic use program. So with that, we'll get to know retailers next. So let's start with Kroger. Kroger's same thing. I went to their website and theirs simply states, Kroger is a recognized industry leader with our offerings in antibiotic-free meats. And then it goes on to say that they have lines that are entirely free from antibiotics and growth hormones. And then the Albertsons, United, Safeway, that family of brands, theirs says, we expect our suppliers to manage the use of antibiotics in accordance with the FDA guidance documents 209, 213, and 152, and the AVMA judicious use guidelines. Costco says their policy is to limit the application of these antibiotics to therapeutic use for the prevention, control, and treatment of disease, and not, for example, for the purposes of growth promotion or feed efficiency, and only under the supervision of a licensed veterinarian in a valid VCPR. And then we'll get to Walmart. So Walmart very simply says, we recognize that antibiotics are one of the critical tools used to keep animals healthy, and that they should be used responsibly to preserve the effectiveness of antibiotics in human and veterinary medicine. And then the second part that's highlighted says, judicious use includes disease prevention strategies, appropriate veterinary oversight, accurate record keeping, and a careful review before antibiotics are used. That's in that first side. And then the next side just says what we are asking of our suppliers to adhere to these requirements. So that's kind of a little bit of brief overview of what the packers and the retailers are saying. But the reason they're saying these things is because they continue to get questions from consumers and pushes from activists. So now we'll get to know know more about these consumers and what their purchasing behaviors are. So this is a 2019 study done by the Food Marketing Institute, and it's conducted on shopper trends. This one's specifically on grocery shopper trends. In this study, they found that 82% of shoppers say that they actively look for at least one on front of package claim. So this specific question was, what claims do you look for on the package when purchasing food products? This goes across all food products, so it's not just at the meat counter, but it's your vegetables, even your center aisle prepackaged goods. What are those things that you look for, and what are those claims? Well, 68% chose claims that were in the avoid a negative category. So antibiotic-free came in at 25%, or fourth in that category, just under no added hormones. When you start looking at these surveys, something to note is that this was one of those here's a list of these claims. What do you look for? So are you looking for this? So you just select all that apply. So then we'll go to the Power of Meat report. So the 2020 Power of Meat report simply sums up all of the grocery shopper, both the scanner data, and it also has a survey portion. So we'll bounce back and forth between both of those, but know that this is conducted on over 5,000 consumers that do the survey, and then all the scanner data at both traditional supermarkets and specialty supermarkets. So with that, it found that claim-based meat continues to be a growth driver for the meat counter, both in the red meat and poultry sectors. So they found that no antibiotics ever grew 2.1% in 2019. That shoppers continue to seek out these claims, but their true understanding of what these claims actually mean is very, very poor. And we'll get into that here in a little bit. So it found that in the survey portion, it asked what were those front of package attributes that you are looking for, or what are those claims that you look for when purchasing meat or poultry. 52% said antibiotic free, and that was number one. Number two was no added hormones, or hormone free at 51%. And then you jump over and no antibiotics ever was at 42%. So again, these are very, very top of mind claims that these shoppers are saying that they are looking for. And then, like I said, their true understanding of what these claims actually mean is very poor. So almost half of them said antibiotic-free meant never given an antibiotic during its life. 30% said only given an antibiotic to treat illness, and less than a quarter, just about a quarter, of the respondents actually gave the correct answer of not given antibiotics during the last and set period of its life. So no residues are found in the meat or poultry. So that's definitely something that supermarkets and we as producers, we can really build on maintaining trust in these claims by giving these shoppers the factual definitions. Perhaps it's in-store signage, perhaps it's on the website, but to be able to build trust, we don't want to give these shoppers misleading ideas of what these claims truly are. So just some thoughts on how to educate the producers educate the consumers on the true meaning of what some of these production claims are. So then we'll come over and look at the scanner data that Nielsen provides. So at the total meat counter, conventional was clearly the winner. We sell the most in terms of dollars and pounds of conventional beef. But then when it comes to claims-based, no antibiotics ever is the number one seller, both in terms of dollars and pounds sold. Now, those other claims do have larger percent dollar change and pound change year over year. But when you're looking at 1.1 billion or 175 million pounds versus 1.9 billion pounds, that's not as much meat to have to grow, both those sales and dollars to change. And then when you look at just beef specifically, beef, again, claims-based meat is a big grower in the grocery segment in both dollars and pounds compared to conventional. But again, it's very hard to grow that conventional number when it's such a large number of both dollars and pounds sold. So now we'll take a look at the natural and specialty channels. This is provided by SPINS, which is the year-long look at scanner data at these specialty stores. So when we look at these claims, the claims grass-fed, organic, animal welfare, antibiotic-free, and no added hormones were the top 5 claims that were purchased at these specialty stores. Interesting enough, the dollars for antibiotic-free was the highest at 273.5 million at these specialty channels. But again, when you look at the percent change, you see grass-fed's the greatest, followed by organic, and then antibiotic-free. So whether it's number 1 in terms of dollars or number 3 in terms of percent change, these specialty stores are really where you will often see trends that develop into those that you start seeing at your regular grocery stores. So it's something to keep an eye on to see where these claims go and how much larger of a section they get at your traditional grocery outlet. So again, back to the survey data and what the consumer said. The question was asked, what production claims do you want more of your meat department to carry more of? And almost half of them said they want more of antibiotic-free and more of hormone-free or no added hormones in their beef. Whereas when you look at the produce section, for instance, the local or the raised in the USA, locally raised, stuff like that is more prevalent in that section. Obviously, this antibiotic-free and no hormone-free are the 2 largest that they want more of their meat department to carry. So when you go to the grocery store, what kind of grocery shopper are you? Do you go to Walmart because you're wanting the best price? Are you wanting the cheapest price for that meat to be able to feed more people? Do you go to an upscale grocery store that has a larger claims-based section, but also still carries your traditional or conventional meat where you'll pay a little bit more? Or do you simply shop at the specialty stores or that only carry those products that have claims, whether it's grass-fed, natural, organic, or antibiotic or hormone-free? So think about that when you're thinking about where this data is coming from, and also about the volume of shoppers and product that is sold at each outlet. So this is a slide from the Food Marketing Institute. Again, they did this research back in 2015. It should be coming up again in 2020. So sometime this year, we should be getting a report. It's done every 5 years. But this looked at the drivers that consumers are considering when purchasing meat. Traditionally, we have these factors on the left: taste, price, and convenience. Price, obviously, ranking number one, and it has been king for a while. And then we've started to see these evolving drivers of health and wellness, safety, social impact, and experience. And they're becoming more of a factor when these consumers are purchasing meat. And they're doing this all in the name of transparency. So when they looked at what consumers indicated were weighing more heavily, in 2015, it finally flipped. So it's been hanging right on that 50-50 line, or 48-52, but skewed towards the traditional price, taste, and convenience. In 2015, it finally flipped. So 51% said they are weighing health and wellness, safety, social impact, and experience more heavily than those traditional drivers. So what does this all mean? So like I said, we have our scanner data and we have our survey data. What we've seen is there is a disconnect. What the consumers say they want in a survey isn't necessarily how they communicate with their dollars. And the other part of this is when you do those surveys, you're also leading these consumers to the questions. Well, do I want antibiotic free? Yes. Is that, do I want hormone free? Do I want organic? Do I want to answer idealistically when I do a survey? Absolutely. But is that actually how I'm going to feed my family and spend my dollars? There really is a true disconnect. So what we can say is that the scanner data and what we've seen is the growth in these claims. That's why they haven't taken off. They are getting more and more prevalent, but they haven't taken off as much as consumers say they will purchase them. So switching gears a little bit, let's talk about consumers during COVID-19 and this pandemic that's still ongoing right now. So have consumer buying habits changed during the pandemic? Absolutely. Who doesn't recognize this shopping cart that when we had the massive toilet paper outage? And then do these meat counters look familiar? Back in March and April, this is a very familiar sight across the U.S. When everyone started to panic, before we got the shelter in place orders. The one on the left is HEB, the three-tiered. You can read the description from Dr. Hale, a professor at Texas A&M. But at 9 p.m. at night, the three-tier self-service case was completely empty. Then the full-service case was completely empty except for the meat alternatives. So that's something interesting there, was that consumers were panic buying and they wanted all the meat, but they left the alternatives. So panic buying, it made it nearly impossible to keep the shelves stocked. Warehouses were stocked, everything was available, but it was simply the logistical nightmare of trying to get this product from the warehouse from the packing plant to the warehouse, from the warehouse to the grocery stores, and all of to keep up with the demand, because consumers were buying more than they could get to the stores in a timely manner. So it was simply a logistical nightmare. And we're finally starting to see that our packing capacity is getting back to normal levels. We're not seeing all of those workers having to slow the chain speeds or cut shifts or simple plant shutdowns due to the virus. So we are starting to see very consistently that our shelves are more stocked. So we'll look at some data from NCBA. NCBA did some consumer research over this last 8-month period. And of no surprise, the pandemic led to an unemployment spike in April. So it's traditionally been around this 3.5%, 4%. In March, it kind of came up a little bit. And then that huge spike to 14% in April. It had never been this high in over 40 years. And then as the pandemic progressed, we've started to get lower and lower. We're about half of what we were in April right now. So that is a positive story, but unemployment is still a major concern. What are those actual consumer concerns? Number one is the economy. 70% are concerned about the economy, 47% about their job security, 55% about kids learning. Is it going to be virtual? Is it going to be in person? Is it a hybrid model? How am I going to juggle that and keep my job? Those kinds of things. Very top of mind, especially for families. And then of lowest concern was, will I even get the virus? Then we start seeing how trends change. So we saw an 84% of consumers' meals are currently being cooked at home. That was a huge increase from pre-pandemic levels. That's 63% said they were cooking at home more, and only 27% said they were cooking at home about the same. And then when consumers were asked, will you continue to cook more meals at home? 66% said yes. And then we have the stocking up dynamics. So what did the consumers do? Come March, April, we saw the panic buying. We also started stocking up. I think in fear of another shutdown, in fear of what of product availability, we started seeing consumers start stocking up. Freezers are sold out. Refrigerators are sold out. All kinds of things. So April and May, 61% were continuing to stock up on the same amount of food. And it kind of dropped a little bit, spiked right before the 4th of July, and then continues to drop, but still about 50% are still stocking up out of fear of another shutdown and product availability. So consumers are changing the way they shop. The pandemic really pushed a lot of consumers to doing the curbside pickup and the home delivery. I know Walmart started offering home delivery in this. I'm very rural Texas. So for Walmart to start offering home delivery was a big deal for us. But all of our grocery store chains are doing curbside pickup. And that really changed. And trying to get those times on curbside pickup was really hard. So what has this done to the meat counter data? Well, in January, it was minus 1% of year-over-year growth in retail sales. In March, spiked up to 46, April 37, and May 52%. We've kind of normalized down to 20 to 25% in our stocking up or year-over-year growth of meat sales. But the cool part is, if you'll watch this red line of fresh beef, it pretty much matches chicken in March, and then it remains above for most of the months through 2020. So consumers still want beef, and they're craving beef, and they're purchasing it with their dollars. Unfortunately, while retail sales have increased drastically, we're not seeing the same pickup and return to normal for the food service group. So full service restaurants, they have had the biggest hit, and they have been the slowest to recover. We've been from only curbside to 25% to 50% to full open, and now we're back to 50% here in Texas. So I know that it's been a real struggle for those full service restaurants, sit down restaurants. quick serve restaurants have not had, they were impacted, but not as drastically as those full service restaurants. And you're starting to see it's kind of level, it's getting back to normal. And they expect it to be about zero at the end of October. Now with all of the increased cases and stuff, I think we might see that continue to remain in the negative, but we'll see what the rest of the year holds. The great news, like I said, you're seeing that beef line continue to trend the highest in year-over-year retail sales growth. We also have seen we've started increasing our beef consumption per capita. So we rose a little bit. So we've been at like 56 to 57 for a couple of years. We've come up to 58 in 2019, 59 pounds is our expected in 2020. And then we're even expected to get up to back to 60 in 2021. So that's a great story, in that people really do want to eat more beef. When you look at March to August, due to price inflation, meat departments were still selling the most in terms of beef. And then when you look at, of that beef, most of it was steak and other, but they had the greatest percent, about 43% has been of the beef value comes from ground beef. So this is self-reported data. Again, they asked 500 consumers each month. And the best news is beef is still ahead of where they were in 2019. So in 2019, consumers said they were eating about 67% beef. And then in 2020, it has stayed above 70% the entire time, with our high in April at 76%. And when you look at willingness to pay data, it found that in 2019, we averaged $7.23 for a steak, and that consumers at their height were willing to pay $9.36, but it's come back down to $8.27. This is partially due to the fact that a lot of consumers have more disposable income because they're not spending it on trips and on vacations and on doing things. It's not basketball teams and football teams and anything that a lot of us do for fun, like going to the movies. We're not spending our money elsewhere. We're really staying home, so we have some extra to spend and really enjoy those meal experiences. Probably the best news out of all of this is that production perceptions in 2020, consumers have had more time to look and research and surf the web, whether it's factual or not. The positive production perception has risen in 2020. In 2019, it was about 38%, and we've been above 40% every month. And we're really taking advantage of a captive audience and really teaching them, educating them on animals and how they're raised and produced. So this is, we're going to look at some headlines. So even with COVID and the pandemic, antibiotic use in meat production has been in the news. This is a 2019 scorecard from the chain reaction. This is the 5th edition. It's been going on 5 years. We should have the 2020 scorecard any day. But interesting, it just ranks all of the food companies on their antibiotic use policies and practices. But when you start reading through the report, I pulled this out. It was really interesting. Policymakers should only allow beef producers to use medically important antibiotics under the guidance of a licensed veterinarian and to treat animals diagnosed with an illness or to control a verified disease outbreak. So I thought that was very interesting, that they don't truly know, these people that are publishing these reports don't truly know how producers are using their antibiotics. So we'll go on. These are some more headlines. So in San Francisco, they have the grocer's report. It's an ordinance that went into place, San Francisco Antibiotic Use in Food Animals Ordinance. They are making the retailers self-report antibiotic use in their meat production offered at the retail counter. Then we have this concern over the next pandemic. It spotlights antibiotic use in meat. Testing will help restore trust. This is from a startup company that talks about using this food ID system to verify that or to authenticate that your claims of antibiotic-free or hormone-free are truly, that meat truly is hormone-free and antibiotic-free. It says that until now you couldn't claim those things. You could only trust what your producers were saying, but they say that by being able to actually test and prove that this will help build consumers' trust. And then the last one is this report. It slams the industry for overuse of antibiotics. So a big activist report that came out talking about the industry just pumping these animals full of antibiotics and how we have how we use so many more pounds of antibiotics in animal production than we do in human medicine, and that's a true problem. But I think that what a lot of these people don't understand are these animals are so much bigger than the human that of course we're going to have to use more of these antibiotics to be able to help these animals if we want to truly provide them the best animal welfare. So with that, I'll leave you with this. Consumers today are more than 3 generations removed from farming and really only know livestock production at a distance. Fewer than 25% have good knowledge of food production. And with this lack of knowledge, it leads to concern and doubt. And when consumers have this concern and doubt, that's when they put a lot of pressure on the supply chain. So when they put the pressure on the supply chain with these doubts, that's what the supermarket chains and the packers, that's what they're taking seriously, because this voice and this concern, they need to get that addressed so that the consumers will continue to purchase products at their location. If these concerns aren't addressed, it could also mean that consumers will completely change or eliminate meat from their diet, which equals less sales. So it also means that we also need to educate these consumers because they could be our biggest advocate once they know and they trust the production and that we as producers are doing the best we can for these animals, and we want them to have the best life, that we're not just recklessly using our antibiotics in our meat production. So with that, consumers want to know more, and that's really what it boils down to, is helping educate consumers so that even if they are only knowing livestock production at a distance, they truly can be able to feel rest assured and be able to feel good about feeding their family conventional meat. So with that, I will take any questions.
Thanks, Jessica. We do have one question over here. It says, what is the market share of traditional or conventional beef versus grass-fed, no hormone or no antibiotic, etc.?
Yeah, so when you look at some of those charts back in the presentation, you'll see that traditional is 95 to 96% of our beef share. And then you'll see organic, grass-fed, no hormones, no antibiotics. Those dwindle off into a couple of percentage points each. But our main driver of the beef industry is our traditional or our conventional beef.
So I have a question now. I mean, the no antibiotic label, what does the packer have to do to qualify for that label? I mean, is it obviously they're not on antibiotics for the last whatever days? I mean, and all withdrawal periods have been met, so it seemed like a fairly simple process.
Correct. So it has to be verified through the USDA. So a lot of them have process verified programs. And like Chad used the alphabet soup, and there's several different ones, but a lot of it is simply marketing. So it just depends. When you look at those labels, a lot of them will have an asterisk to explain whether it's just adhered to the withdrawal or if they have had no antibiotics throughout their life. So those a lot of those no hormones, NHTC, no hormones, no antibiotics, the never ever 3, they are the ones that have not had antibiotics out over their whole lifespan. So it just, you have to be very cautious or pay close attention to what those labels actually say and what those asterisks say in the very fine print underneath.
So I guess my next question would be, how does the packer or the retailer go about justifying taking some of these stances when we know that antibiotics are actually needed sometimes for like disease and control or prevention, like anaplasmosis? Okay.
Right.
But by the time that animal goes through the feeding system or through the production system, there is absolutely no antibiotic residue in there. Are we not telling the story correctly, or what's going on?
Yeah. So if you'll look at it, so when I went through all of those packers, all of their websites say judicious use and follow VCPR and along those lines, but they never say producers cannot use antibiotics because they know that they're a very, 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 very valuable tool to our producers. So and in the spirit of animal welfare, the animals need antibiotics too when they are sick or to treat, control, prevent. So with that, the packers will never tell you, or on the beef side, they'll never say no antibiotics, you cannot use them, because they do want you to care for your animals and give them the best care. But they will say if you do choose not to give them over their entire life, then you go through all these audits, you get an EID in those animals, and then those can be sold for a premium in a separate segregated group that can be labeled for whatever that program is. So a lot of these packers do have these specialty programs for these retail outlets, but that is a very small portion of what the packers are really producing.
So my next question would be is, who are they auditing? How far back do the audits go? In other words, they audit the feed yard.
So it depends on the program, but the no antibiotics goes all the way back to the cow-calf producer. So that cow-calf producer, they have a third-party auditor come and verify. They go through, it's almost a full-day audit with the auditor there. They look through all the records, the written records and documents, and then they actually go out and look at your processing barn, look at your cattle to verify that everything that you're saying is antibiotic-free truly is. And then they'll go, then that EID, those cattle get an EID, that gets passed on to the feed yard. And most of these feed yards are the ones you can't, it's not a written affidavit like at the packer. And so the packer written affidavit is simply just, yes, I have met the withdrawal, period, no antibiotics. But the specialty programs is the EID so that they can track them all the way through the system.
So how much value are they adding? And then what is the cost to production when not just with antibiotics, but say they go no hormones added?
So it just depends. It depends on where you are in the production system. And I actually, Dr. Hutchison, tomorrow night could probably answer that better because he's more familiar with the superior data. But it depends on where you are in the system, if you're retaining ownership through the feed yard or if you're selling them to the feed yard that way. So I can't give you a definite answer because it just depends.
Thank you. I was just reading some stuff coming in from Dr. Griffin. He said FDA published a human antibiotic sales report in 2012, their last report, and then Dr. Apley calculated the pound use in humans and animals. He estimates the suggested pound per pound humans used more antibiotics than all meat and poultry production in the U.S. So pound for pound.
I would absolutely believe that because you look at a lot of the articles of doctors overprescribing or prescribing antibiotics when you have a virus or something like that. So I absolutely believe that, Dr. Griffin.
So the other thing, Ronnie Abel is saying there are a lot of loads of feeder cattle being marketed into Carolinas as GAP4, which means no implant, no antibiotic, no ionophore. So yes. I just, I think that these are important things, but I also wonder if they're returning enough money back to the producer to cover the lost production for not using those technologies.
And that's a good question. And it like I said, it depends on what kind of contract you have with your packer or whoever the end person is. Because I know firsthand experience, my father and brother do this, right, wrong, or indifferent. They lost a lot of money retaining ownership through the feed yard on their never ever cattle. So I know that it depends on who you are and how big it is.
Good deal. Do we have any other questions for Dr. Finck? Well, Jessica, we certainly appreciate you talking with us tonight. If there's anything that anybody has any more questions, please feel free to ask or to send us. And with that, I think we will move on if there's no more questions. Oh, well, here, I take it back. Here it is. Is there a demand for more antibiotic-free beef, or has the production not caught up to demand?
I would say I don't know that the demand is more because when the packers have too much, then they have to turn around and sell it as just regular. They can't mark it up for that. So production hasn't. I wouldn't say production hadn't caught up to demand. I don't know that the demand is there for the price.
That's kind of like the organic dairy. What makes an organic dairy profitable?
Yeah.
Conventional dairy next door?
Yes.
Okay. let's see if there's anything else. Okay, so we appreciate it. Thank you so much.